Hi, it's Dr. Chris Kawa from Discover Chiropractic in Brick, New Jersey. I'd like to talk to you today about carpal tunnel syndrome and what it really is and what most people who have symptoms in their wrist and their hand are actually dealing with, because as it turns out, it's not actually carpal tunnel syndrome. Carpal tunnel syndrome is a specific condition that involves the median nerve. The median nerve comes down from your neck, comes down through your arm, comes down through the carpal tunnel, which is actually a tunnel made up of ligaments and muscles that go through, innervate the middle finger, parts of your ring finger and index finger, and supplies those muscles and so forth with nerve energy. However, most people who have hand symptoms, whether it be numbness, tingling, pain, do not actually suffer from carpal tunnel syndrome. Now, the carpal tunnel surgeons would like you to believe, oh yeah, that's definitely carpal tunnel syndrome, because we're just going to slice and dice and free up that nerve and everything's going to be great. And some of you may have had that surgery already and know that usually the pain usually comes back after 6 months or a year. So most pains in the hands and wrist are not actually from the carpal tunnel, they're from the neck. These are where these nerves originate. Everything in your arm and hands comes from your neck, usually the 4th, 5th, 6th, 7th, and 1st level of your thoracic spine. And most people have compression and joint function problems in their neck that create symptoms that mimic carpal tunnel. Probably 98% of the time it's not true carpal tunnel syndrome. So what happens most of the time is that you'll be, this person's facing this way, that almost everybody, and you may be in this category, almost everybody has forward head posture. That's when the curve in the neck, the nice curve, the neck starts to straighten and actually go forward. And that creates a lot of stress on the disc in the front and on the joint itself. And after a while, the discs start compressing to the point where the jelly that's in the middle of the disc starts pushing out the back and encroaching upon some of the nerves. And that's when you first start feeling weird things in your hands, like if you rest your elbow on something and then your hand starts getting numb, or you wake up in the morning and you're sleeping like this and your hand is painful or numb or tingling. Those are usually because of the neck. Now, like I said, the hand surgeons would love you to believe that it's your hand, but it's your neck. So what do you need to do? Well, first and foremost, you need to get your spine checked so that all the joints in the spine, especially the upper neck and the very lower neck, are moving properly. Because what usually happens is that almost everybody has a fixation where the joint gets locked up in the very top of the neck and the very bottom of the neck. And what happens when you have that is that something's going to compensate. You're going to have compensatory movement, too much movement in the middle of the neck because it's locked in the very top and the bottom. And that excessive motion causes a wear and tear over years and years. So you have posture deficits, you have a wear and tear going on, and slowly but surely those nerves in your neck are going to be compromised to the point where you'll start feeling it in your hands. You might feel it in your shoulder, your elbow too, but most people it kind of goes to the hands. They get numb, weak. You'll start picking up things and the hand is weak. So my specialty is to go in there and figure out what specific joints are not moving right, and to deliver very concise, precise, delicate pressure to create movement in the joints. Okay, these are called specific precision chiropractic adjustments. Okay, so what that's going to do is it's going to free up the top of the neck and the bottom of the neck, take the stress off the middle, and then what we need to do is do some therapy to restore the curve. Okay, that's very easy. You can do it at home, but we need to teach you how to do it. And then we need to do some tractioning of the neck to make sure that the discs spaces are like they should be, so that the nerves can be completely free, and that usually takes away all the symptoms in your hand. So if you have any questions about this, it's a very simplistic explanation. There's a lot more to it, but that's the crux of it. So if you have any questions, don't hesitate to email me. It's Dr. Kawa at chiropractorbricknj.com. It's DRKAWA at chiropractorbricknj.com, or give us a call. I'd be glad to give you a call back or make an appointment to come in and consult with me. Our consultations are always no charge. You can sit down, ask me any questions you want, and I can tell you whether or not that Discover Chiropractic is a possible place that could help you. I'm sure it is. So stay well, be well, and I will see you soon. Thanks.